Hi all, this is Mushida Yasmin, Assistant Professor from SNS College of Physiotherapy. Here I'm going to discuss about a clinical condition called Myasthenia Gravis. So in this picture, you can see a normal neuromuscular junction and also Myasthenia Gravis neuromuscular junction. So in normal neuromuscular junction, there is a nerve ending and muscle ending. From the nerve ending, there are acetylcholines from the nerve end, and the acetylcholine are getting attached with the nicotinic receptors at the muscle end. Then with the help of acetylcholine, the muscle is getting contraction. In case of myasthenia gravis, the acetylcholine are released from the nerve end, but the antibodies against the nicotinic receptors will prevent the acetylcholine in getting attached with the nicotinic receptors, so that the muscle will get the disruption in acetylcholine component, so that the muscle contraction will be less in myasthenia gravis. So that is the basic component of the myasthenia gravis. To introduce this myasthenia gravis, it is a chronic autoimmune disorder and it causes fluctuating muscle weakness. So this weakness worsens with the activity and improves with the rest. So it affects the voluntary muscle, so which will lead to fatigue. So autoimmune basis is the basic pathophysiology for the myasthenia gravis. So and in myasthenia gravis, the communication between the nerve and muscle will get disturbed. So to prevent it, the myasthenia gravis is relatively common in India and management varies according to the region. So pathophysiology speaks that antibody production against the nicotinic receptor is the major pathophysiology for the neuromuscular junction activity of the myasthenia gravis, and the receptor blockage is the another pathophysiology, and impaired transmission is the next pathophysiology. In the nerves fail the signal to reach the muscle, and also muscle weakness is the major characteristics of the pathophysiology in the myasthenia gravis. So to present clinically, the ocular symptoms and bulbar symptoms and limb weakness together will present in the myasthenia gravis. Ocular symptoms like ptosis, diplopia, and often it manifests first in the myasthenia gravis. And bulbar symptoms like dysarthria, dysphagia, and facial weakness is the symptoms in the myasthenia gravis. And the limb weakness involves proximal muscle is getting more affected, difficulty in daily tasks, and it can be asymmetric also in myasthenia gravis. So how to diagnose this? You can see the tests which are all needed to confirm the myasthenia gravis. Physical examination with the thorough detailed history and neurological examination, and the blood tests which involves antibody testing which detects the acetylcholine receptors and the antibodies against the nicotinic receptors, and it confirms the autoimmune nature of myasthenia gravis. And EMG is highly sensitive in diagnosing that, and also nerve conduction study. Single fiber electromyography is crucial in diagnosing the myasthenia gravis, and also heterophonium test is the useful in diagnosing and the concluding the myasthenia gravis. So symptomatic management is needed to treat the myasthenia gravis, which involves symptom relief, which directly addresses the muscle weakness, and increase in the acetylcholine sensor receptors, which boost the acetylcholine at the synapse, and improving the function, which enhances the muscle contraction strength. So we need a immunomodulatory therapy to suppress the autoimmune response for long-term control. What are all the immunomodulatory therapies are here? Corticosteroids, immunosuppressants, IVIG plasmapheresis, and biologics like risankizumab, ecozolizumab, and target-specific immune cells are used in the immunomodulatory therapies. So managing myasthenia gravis. So understand the critical caring and also the critical intervention, and urgent care is needed in myasthenia gravis. So it is a life-threatening complication. It involves severe respiratory muscle weakness. Urgent medical intervention is critical. So patient often require intubation and mechanical ventilation also. So respiratory support, rapid immunotherapy, and ICU monitoring is vital in managing the myasthenic crisis. So long-term management include regular follow-up, medication adherence, lifestyle adjustments, patient education is crucial in living with the myasthenia gravis patients. So it aims in minimizing the symptoms and improve the quality of life. Also regular follow-up is needed. To conclude this, There is a personalized medication which is tailored towards the individual patient profile, and novel therapeutic approaches and improved diagnostic is needed in treating the myasthenia gravis. Thank you.